and have a look. So it is 187 pages, but it's actually really, really well structured. And like many of these big documents that we look at, actually the top tip is really to have a look at the executive summary, read that, have a look at the contents pages, because that gives you an idea of the structure of the document and what's in it. Flick to the bits that you're interested in, and also have a flick through and have a look at the charts and graphs and the breakout boxes. And you can probably get, about 80-90% of what you need from a document by doing that. Have you got any other tips, Gandhi, for trying to digest these big documents?
No, I think, the executive summary is only a couple of pages long, which sets out the tone. As Andy said, there's lots of good graphs as well. But don't worry, we're not going to go through all 187 pages. We've picked out the key points and stuff that are relevant, particularly to this significant DDRB report, because this is the first time in 5 years that GP partners have been included in the DDRB report. And that's probably the reason why we're covering it, isn't it, Andy? It's one of the contributing things.
Yeah, I think so. Yeah, we had that 5-year pay settlement before that ended this year. So first time it's looking at GP contractors for some time. So interesting. One of the opening pages just talks about the remit that they have. So they provide independent advice to the Secretary of States in the various nations of the United Kingdom about pay recommendations for increases in pay for doctors and dentists of all grades this year, because GP partners are included. And they're asked to take a number of things into consideration when they're making their recommendations. So they need to think about actually the need to recruit, retain, and motivate doctors through pay. Pay is an important part of that. Think about variations in the labour markets and the effect that those have on doctors and dentists. And there's some interesting charts actually where they compare with salaries in other comparable professions. It's actually a really kind of well done report, in my opinion, having picked it up, and actually a lot more interesting than you would think. Think about the funds available to the government. So that is within their remit to consider available funds. Think about inflation targets, and they take historical inflation into consideration as well. And think about the overall NHS and NHS workforce strategies. So they have to take all of those things into consideration, and the government can ask them to take additional things into consideration as well if additional things are relevant each year. So with us so far, everyone?
Yep. I guess the other thing they do make reference to a couple of times is the NHS long-term plan, which is a document we covered last year when it came out, and that does inform a lot of the decisions that they've made in this particular document, even though some of that is not necessarily relevant to their remit. But obviously that's been asked to be looked at as well.
Yeah, good. So following our own advice, we then had a look at the contents, and we're going to look at the executive summary, which isn't too long. We'll also look at the evidence that they take into account, because it's quite interesting, the sources that they draw from, and they list all of those together. We'll look at the recommendations, of course, and then probably the section on general medical practitioners, where there's some stats about the workforce, is quite interesting as well as perhaps some of the stats around junior doctors. So shall we have a look at the executive summary, just so people can see what's in there? Not one of those documents where you can click on the things and it takes you there. That we'll have to scroll, so there might be a bit of journeying up and down the
say to the DDRB, make your documents clickable, please. It makes life a lot easier to navigate around it.
Yeah, in this digital age, not everybody's printing these anymore. It's easier to
not if it's 187 pages long. We're not.
It's easier to flick through a printed document than scroll up and down a really long digital document. So please do that. Pay for the more expensive version of Adobe Acrobat that lets you do that, or whatever you need to do. So the executive summary is quite structured, really. So they talk about their remit. They talk about the pressure that the NHS is under, and the size of waiting lists and pressure on the workforce. They do talk a number of times about the NHS long-term plan, and that is ambitious in terms of the need to recruit and retain medical professionals. They also talk about the government's aim, at least at the time, to reduce dependence on international medical graduates. So that's an interesting point, and they provide some stats on that later. They're making particular reference to the GP workforce, saying that actually that's not showing the growth it needs to meet the demand, so the growth in number of demands and the growth in number of expected appointments over the next few years. And there's a trend towards part-time working, which, and I think last week we talked a little bit about the trend or the changes in working hours in general practice, an interesting publication in the BMJ around that. But they acknowledge that as well. So that puts additional pressure on the need to increase the GP headcount. They make a special, they make a mention of actually doctors and dentists are dissatisfied with their working lives and their level of pay. Most acute in doctors and dentists in training. And actually, they do make a differential recommendation for that group, which we'll get to later. And they recognise that the industrial action has had an effect of sort of weakening further morale. I mean, is it the symptom? Is it the cause? But that's added to the pressure and frustrations of this element of the workforce. They recognise that they are making these recommendations when inflation is currently falling, but has in the past been at very high levels over the past few years. So they recognise that. The other thing they do recognise is that the UK government has said that anything above 2% will have to be found from elsewhere within the NHS budget. That's what they've been told by the government at the time the report was produced. So, if there's a 4% disparity, if wages are going up by 6% and the overall NHS budget's gone up by 2%, well, that difference is going to have to be found from somewhere within the NHS budget, which will mean, I guess, cuts or rationalizations or efficiencies elsewhere. So, and then I guess we get to the actual recommendations themselves. So they recommend a 6% increase across the board, essentially, for all doctors and dentists. And they recognise in particular that junior doctors and junior dentists are particularly suffering. So they recommend that they get the 6% plus a consolidated uplift of £1,000 to all the pay points, which equates to something between 7.6 and 9.5% of their basic salary across that group. So that's really the executive summary, Gandhi. So any thoughts or reflections before we maybe have a look at some of the information that's informed those decisions?
So I think for me, the part that I found quite significant was the fact that even though they were told that anything above 2% will need to be found, basically an indication from the government, anything above 2% we're probably not going to pay, or we're going to struggle to pay, that despite that, they've still come up with a 6% figure. Now, I think they recognise that that's still probably not enough to balance some of the inflationary challenges that the professions have faced, but they do recognise those challenges. And interesting that they've encapsulated those challenges, particularly for newly qualified doctors, and recognising that they probably need some additional financial support because of the current structure and processes in place that exist with newly qualified doctors and stuff. So, like you mentioned, moving around, the fact that they are told they have to go from hospital A to hospital B, all that kind of stuff, it's an interesting concept. And I don't think I've ever seen that kind of response before from the DDRB either.
So yeah, it's interesting, isn't it? And I guess in terms of where does that differential come from, I guess they would say that's not within their remit. They are asked to answer those questions about recruitment, retention, having the workforce that we need going forwards, to take into account the budgetary restraints, but they're not completely limited by them in terms of the recommendations that they make. So let's have a look. So where do they get their evidence from? That's really interesting question, isn't it? So they get written evidence submissions from a number of places. So Department of Health and Social Care, Scottish Government, Welsh Government, Department of Health, that's Northern Ireland. So from the government in all of the nations of the United Kingdom, from NHS England, from NHS employers, NHS providers. So NHS employers who represent the employing organisation within NHS providers, those people providing services by employing people. The British Dental Association, the British Medical Association makes a submission into this as well, and the Hospital Consultants and Specialists Association all provide submissions, and there might be individual submissions, they say, from subcommittees within those organisations. So the GPC, for example, within the general medical, within the BMA, would be submitting evidence. They also conduct visits to various places across the country. They can't visit everywhere, of course, but they say where they have visited organizations. They do focus groups when they visit these organizations. So they've had 15 discussions with consultants, I think 9 with groups of general practitioners I saw within the report, for example. And then they also consider economic and workforce data prepared by their organization, drawing from government data and broader research. So that's where they get their information from, if people out there were wondering. Let's skip to the GP section. As I say, we're moving along at a fair clip, so there's lots and lots of information about the other areas of the workforce. I'd highlighted something within the junior doctors actually, but I think let's just stick with general practitioners. So just some things that jumped out at me, Gandhi, were they acknowledge that there's another 100,000 appointments being delivered this year compared to last year, an increase of 7.8%. So they acknowledge that there's more work being done in general practice. So acknowledging some of that's not done by GPs, that some of that increase is due to other professionals as well. And they highlight that there's only been a small increase in headcount of full-time equivalent GPs, particularly in Ireland and Wales, in contrast to a substantial growth in the number of hospital doctors. So the workforce isn't sort of going where it needs to be, or meeting, or the the shape of the demand that comes through. I think one of the only groups that have fallen in number over. They looked at a 5-year period, was GP partners, and GP partners are down 15% over a 5-year period, and down 2.2% over the 1-year period to 2028. And salaried workforce are up from 37 to 46% over the last 5 years. So that raises concerns about the sustainability of the partnership model. They're not the first to raise those concerns. And they also highlight 2 emerging possibilities, which I think are interesting, because we talked about this. And on our forays to London, we've met GPs saying, I'm an NHS and private GP. People often said that the further south, that you go and talk to people and they say there's a risk that increasing number of patients choose private GPs due to difficulties accessing GP services on the NHS, and that GPs might be more attracted to taking on private patients to meet this demand, and therefore further reducing the NHS GP services. As a consequence, general practice in the future could start to face some of the challenges of provision seen with dental services. Not the first time we've heard that argument, and I don't know whether DDRB have made that argument before, but it's, I think, very interesting that it's in this document that sort of spiral might occur, and it could become a self-fulfilling prophecy. So let's have a look. There's some charts later which are really interesting. So just to show some of the data that people can pull out. Oh, we've ended up with the recommendations. I think we've spoke about these 2 recommendations already. So let's have a look. Oh, so here's some of the just some of the data. So they're looking at drawing from a wide range of data sources. So number of applicants to medical school, number of people accepted to medical school, showing a decrease in the number of applicants from 22 to 23 and beyond. This is interesting. So this ranks a number of countries. It looks like European countries, by percentage of doctors that are foreign trained, given that the NHS workforce plan, one of the aims is to reduce dependence on foreign trained doctors. That's one of the stated aims. And United Kingdom is about 8th in this group in terms of having a higher proportion of foreign trained doctors, at about 32%. All sorts of interesting graphs. Let's have a look through and see what grabs our attention. Oh yeah, so this was interesting, Andy. These graphs, just to show the sorts of things they're taking into account. So this is comparing a foundation year 1 doctor compared with professional comparator groups. So people working in the legal profession, finance and accounting, pharmaceutical, academic posts such as lecturers and teaching assistants, just showing how that sits next to those professions. Because we always thought we need to attract, doctors, I guess, people who have the ability to be good doctors in terms of their academic and their empathetic qualities. So it's important to compare them with similar professions, and then it looks at different points in the job market as well, in their kind of journey through their career. So year two, and then looking at kind of registrar level people. And it's interesting that you can see actually certain other professions now outpacing the salaries of medical professionals at this stage. So I thought that was a really just interesting bit of data there. And let's look at some of the data around general practice. So what did I picked out? Just jumping there. So GP headcount for 100,000. So this is something that we talk a lot about, Gandhi, which looks like it's been going up in Northern Ireland, actually, over the 5-year period that they've been looking at this data, and just steady drift down consistently in England by the look of things.
Pretty much since COVID, isn't it?
Yes, much more pronounced since COVID. This table, almost don't want to show this. And it's a good job it's so small, because compared to some jobs that people work, the amount of money that GP contractors earn, looks quite high, although this is before a lot of expenses, and they do say that in the notes below. So it isn't representative of take-home pay by any means. But if you're at all nosy about the pay that people get at different points in their career, then that information is within this document as well. So that's really just giving some examples of what is in the document and the sorts of data points that they are looking at. And I think it's a really well put together document. I was really quite impressed. I don't necessarily agree with the conclusions every year, and I think it's interesting that pay in the medical profession is outpaced as people come to registrar level and beyond by other sorts of comparable employment. But I was quite impressed with the remit that they're given and how they go about filling it. Did you have any reflections, Gandhi?
I think, like you say, it's a well-reasoned document, and it has lots of useful information to understand why they've come to the decisions that they've come to. I think many working within the profession would feel that it still needs to be higher, but that contributes to other reasons why I think that's the case, because obviously the DDRB also has some elements of wanting to be in line with the government directives that they're given, which is understandable because it's what it's meant to respond to. I think the interesting part is the recommendations are combined for all the different aspects depending on the roles. It's not separate recommendations for GP partners versus separate recommendations for salary GPs versus dentists and that kind of stuff. Whereas I think in some years they have given separate recommendations, but this time around it's just been a universal one, which makes it really interesting, because I think that confuses some people sometimes, in my personal view, because if that's the case, then how do you give GP partners a 6% pay rise? That's really confusing to me.
It's really, really difficult, isn't it? Particularly given that there's no salary scale for GP partners. So the other interesting thing is they did break out the junior doctors as a separate case as well. Given, I guess, the data they have about where their pay sits and the experience that they have and what's required to attract people to those posts. And I guess the remit they're given is to balance a number of things, including to some extent the budgetary constraints as well. So they have to do that within their remit. So I think it's a really interesting report, and I think more people should pick it up and have a look at it, not necessarily read all of the pages. And to be honest, as a GP, I was much more interested in the GP section than I was the section about SAS doctors, for example. But it's good. So hopefully people have enjoyed this brief foray into the 187-page DDRB document, and maybe we'll pick it up again next year. It's certainly interesting to know what's in it and what their remit is and how they go about fulfilling that remit.
And I think if you want to know why we picked this as the topic to talk about, well, a lot of that was based off the previous recommendations we had a couple of weeks back, which was around the GP uplift, which was actually at 7.4%. If you want to find out more details about that, then check out this episode right here. Certainly, there's probably other content coming up. And as always, we'll be here to take enhance your primary care and learning. We'll catch you in the next episode.